a project that aims to educate Filipinos about the different genetic disorders, and we will educate Filipinos and persuade them to help alleviate the conditions of Filipinos with genetic disorders.
Diabetes mellitus, commonly known as diabetes, is a metabolic disease that causes high blood sugar. Diabetes stems from a combination of genetics and lifestyle factors. Being overweight and obese increases your risk too. Carrying extra weight, especially in your belly, makes your cells more resistant to the effects of insulin on your blood sugar. And this condition runs in families. Family members share genes that make them more likely to get diabetes and to be overweight. Here are a few things we can do to delay or prevent diabetes. Get at least 150 minutes per week of aerobic exercise such as walking or running. Eat more fruits, vegetables, and whole grains. Eat smaller portions and try to lose 7% of your body weight if you're overweight or obese.
Anemia is a condition that develops when your blood lacks enough healthy red blood cells or hemoglobin. Hemoglobin is a main part of red blood cells and binds oxygen. If you have too few or abnormal red blood cells, or your hemoglobin is abnormal or low, the cells in your body will not get enough oxygen. Anemia occurs when your blood doesn't have enough red blood cells. This can happen if 1. Your body doesn't make enough red blood cells. 2. Bleeding causes you to lose red blood cells more quickly than they can be replaced. And last, your body destroys red blood cells. Symptoms include headaches, chest pains, fatigue, lack of energy, irregular heartbeat, and pale skin. The treatment for anemia is taking iron supplements or dietary changes. If the condition is due to loss of blood, the bleeding must be found and stopped. And if it is a severe type of anemia, the patient will receive blood transfusions or bone marrow transplants.
What is asthma? Asthma is a chronic disease of the airways that makes breathing difficult. With asthma, there is inflammation of the air passages that results in a temporary narrowing of the airways that carry oxygen to the lungs. Cause. It isn't clear why some people get asthma and others don't, but it's probably due to a combination of environmental and genetic factors. Symptoms: shortness of breath, chest tightness or pain trouble, sleeping caused by shortness of breath, coughing or wheezing, a whistling or wheezing sound when exhaling, coughing or wheezing attacks that are worsened by a respiratory virus, such as cold or the flu. Signs that your asthma is probably worsening include asthma signs and symptoms that are more frequent and bothersome, increasing difficulty breathing. Cure. While there's no way to prevent asthma, by working together, you and your doctor can design a step-by-step plan for living with your condition and preventing asthma attacks. Follow your asthma action plan. With your doctor and the healthcare team, write a detailed plan for taking medications and managing an asthma attack. Then be sure to follow your plan.
What is breast cancer? Breast cancer starts when cells in the breast begin to grow out of control. These cells usually form a tumor that can often be seen on an X-ray or felt as a lump. The tumor is malignant or cancerous if the cells can grow into or invade surrounding tissues or spread or metastasize to distant areas of the body. Breast cancer occurs almost entirely in women, but men can get breast cancer too. Researchers have identified hormonal lifestyle, and environmental factors that may increase your risk of breast cancer. But it's not clear why some people who have no risk factors develop cancer, yet other people with risk factors never do. It's likely that breast cancer is caused by a complex interaction of your genetic makeup and your environment. Signs and symptoms of breast cancer may include 1. A breast lump or thickening that feels different from the surrounding tissue. 2. Change in the size, shape, or appearance of a breast. 3. Changes to the skin over the breast, such as dimpling. 4. A newly inverted nipple. 5. Peeling, scaling, crusting, or flaking of the pigmented area of skin surrounding the nipple or areola or breast skin. Cure. Ask your doctor about breast cancer screening. Discuss with your doctor when to begin breast cancer screening exams and tests, such as clinical breast exams and mammograms. Exercise most days of the week. Aim for at least 30 minutes of exercise on most days of the week.
Alcoholism, also known as alcohol use disorder, AUD, is a broad term for any drinking of alcohol that result in mental or physical health problems. Liver cancer is a cancer that begins in the cell of your liver. Your liver is a football-sized organ that sits in an upper right portion of your abdomen, beneath your diaphragm and above your stomach. Several types of cancer can form in the liver. The most common type of liver cancer is hepatocellular carcinoma, which begin in the main type of liver cell. Cause: primary liver cancer tends to occur in the liver damaged by birth defect, alcohol abuse, or chronic infection with disease such as hepatitis B and C. Symptoms: persistent insomnia, nausea or vomiting, seizures. Hallucination. Prevention. Maintain a healthy weight. If your currently weight is healthy, work to maintain it by choosing a healthy diet and exercising most days of the week.
Always remember,
That your present situation is not your final destination.
Because the preservation of health
Is easier than the cure.
RTC!